Okay, so just a couple of slides on raised ICP. So we've talked about lots of problems that might cause raised ICP, like malignant MCA syndrome and stroke, subarachnoid hemorrhage. We'll just touch on why we have that. So not to be patronising, but the skull is a box. It's an enclosed box. It has structures inside, like the brain. If you get increasing pressure from a growing structure like a tumour, or there's bleeding or there's swelling, it can't be accommodated for long. The pressure becomes critical and you begin to get damage and infarction of the brain itself. And unfortunately, the only place the brain has to go is down, out through the spinal canal. And we call that coning, which is lethal. Permanent death or damage is likely if you're unable to arrest or treat that either medically or surgically. So what are the causes of raised ICP? We talked about a lot of them in previous lectures. So in stroke, cytotoxic swelling, if there's ongoing bleeding, extradurals, subarachnoids, subdurals, hydrocephalus. So if the passage of cerebrospinal fluid is blocked due to the ventricles being blocked for whatever reason, then you get hydrocephalus because the CSF just swells and you get big ventricles, so you need shunting to let the fluid out. Structural problems like a brain tumour, trauma, and you get infective problems, so meningoencephalitis or an abscess can cause swelling. And a slightly different situation is idiopathic intracranial hypertension. So let's talk about that. Slightly unique condition, so it occurs in younger fertile women. We think it's in the context of estrogen in people who have a particular predisposition. We aren't quite sure why it happens to some people and not others, but in certain people who are susceptible, if they have a high estrogen situation or they put on weight, then there's an overproduction of or an increased pressure of the CSF around the brain and the spinal cord, and that can cause headaches, high pressure headaches, and compression of the optic nerve. And if it's not treated, the patient can lose vision permanently or become blind. So, in order to work up these patients, you should have a high index of suspicion, and essentially you're looking for papilledema or swollen optic discs. So if you hear a history like this in a young woman with these risk factors, if she's overweight or she's recently put on weight, she's on the pill or she's pregnant, she has headaches that are worse lying down and better standing up, the vision kind of greys out or becomes blurry and she's really struggling, then you need to look at the back of the eyes and look for papilledema. In that situation, you need to exclude a blocked cerebral vein, so a venous sinus thrombosis, by a CT venogram. And if that's not present, then it's likely that somebody has IIH. So if there's no contraindication from imaging, you do an LP and you'd measure the opening pressure. So in the past, a normal range was 8 to 14. That's been expanded in modern times. So we tend to say now if somebody's above 24 to 25 centimetres of CSF, that's probably abnormal. You can treat with medications like acetazolamide and topiramate, which can reduce CSF pressure a bit, but the only thing that really cures this is weight loss, which can be difficult for some people. Pregnancy can worsen IIH, so if these patients who have IIH become pregnant, their IIH can worsen and the threat to their vision increases, and they cannot. Pregnancy is not compatible with acetazolamide and topiramate, so you cannot become pregnant on these medications. So if you diagnose somebody in pregnancy, it's very, very difficult to manage, and that may require a shunt from the surgeons. So we've talked about IIH management, but from raised intracranial pressure from other reasons like stroke or trauma, you need an ICU, you need mannitol, which can reduce the pressure a bit, cooling, but quite often neurosurgical decompression is needed. Hydrocephalus, if you see that after a stroke, for example, because CSF can't leave the brain, you'd see growing ventricular size, and here I've got a nice scan of very, very big ventricles from obstructive hydrocephalus, and patients become sleepy, confused, and they get swollen optic discs and headache.